Sex therapy is therapy that would focus on anything related to physiology or psychology around sex and intimacy. So for men, there would be kind of erectile dysfunction, high sex drive, low sex drive, um, pain, pleasure issues. And those can have a physiological component and a psychological component. So when we're doing sex therapy for men or for women, and women that can be kind of pain, it can be arousal issues, it can be trust issues, and all kinds of things in that area. So we do assessment because this is an area where sometimes we work with outside practitioners. So sex therapy is very multidisciplinary. So with men, often you might need the help of a family doctor or a urologist. With a woman, it might be family doctor and a gynecologist or a pelvic floor specialist for physiological issues. So that's what we don't do in sex therapy as a psychotherapist. But what we deal with is some of the psychological components that can contribute to, say, an unhappy sex life. So for instance, with men and erectile dysfunction, large percent of the time it is psychological. And most often when we scratch beneath the surface, there's a lot of self-esteem issues. There's a lot of sense of pressure to perform, pressure to be kind of a Superman. A lot of this comes also from viewing pornography and kind of seeing, kind of certain kinds of artificial sex performances. So a lot of sex therapy with both men and women is to normalize the imperfection of sex, right? That sex is not always perfect, that it's an ongoing, evolving dialogue with your partner, right? That there's many types of sex. There's more than intercourse. You can have, there's many types of sex even within one encounter, right? You can kind of change kind of streams or change the type of dynamic you're having in the middle of it. That a lot of the work in sex therapy is to kind of normalize this, is to normalize that there are, sex doesn't happen one way. It's not always mind-blowing, perfect, mutually exciting. Sometimes it is, and that's great. But most of the times, or many of the times, it's not, and that's okay. And we kind of talk about that, and that's where some of the anxiety can really slip in, because I think sex is an area where both men and women put a great deal of pressure on themselves to be optimal for their partner. And so I think sex therapy is about looking at some of the self-esteem issues under that, the issues of trust that are under there. Sometimes it's issues of relationship stability, right? That if we don't have a good sex life, what does this mean for our relationship? You can come in for sex therapy as an individual, and sometimes that's often suggested, right? That you come in first because sometimes it's easier to talk to a therapist than it is to your partner. You can voice your concerns to say, I'm afraid of, if I tell them this, that they're going to do that, right? I'm afraid of telling them that if I'm not interested in sex, or if I don't always, I'm not always in the mood for sex, I'm afraid that they will love me less or trust me less. So sometimes it's easier to talk about that with a therapist, and then we can talk about strategies of communication, how you might bring that up with your partner. And again, normalize some of these questions to say, hey, this is not maybe as scary as you think it is. So a lot of sex therapy can be done individually. I think most of the sex therapy I've done has been done with individuals. For men, I think with erectile issues or erectile dysfunction, there's a whole host of anxiety, and so a lot of that is talking about all the thoughts and fears that go along with that. What does that say to you? What are you worried about? Are you where does your head go? because a lot of erectile concerns can be kind of thoughts that are just getting you out of the mood and into scary places.